Hello, my name is Caitlin Cooper, and today we are going to be talking about Shop Talk, which is a therapeutic board game designed for children and adolescents diagnosed with cancer. This board game was created by Lori Weiner and Cindy Mamalian for youth with cancer from the ages of 7 to 16. There are 3 versions of this game that are available for people to buy. One is for the pediatric cancer patient. The second version is for their siblings, and a third version is available for children whose parents have been diagnosed with cancer. Okay, so now that we have finished with the introduction, we'll move on to talking about the rules and aspects of the game Shop Talk. So Shop Talk is a colored board game. It has 10 stores that the players can visit, which include a hat, book, toy, jewelry, pet, clothing, sports and shoe store, a movie theater, and a food court. Each of these stores has 6 items available for sale. And the players are not able to purchase the item until they answer one of the 15 question cards that are located at each store. Each participant is never forced to answer a question. If it's too uncomfortable for them, they may choose to pass, but it is encouraged for the participants to answer the questions. The game can be played with up to 6 people. So for this particular study that we'll talk about right away, they used 3 different sessions, one individually with a psychologist, one with a caregiver, and then a group setting. So this game can be played in a different number of ways. So the game itself follows a typical game board style with a dice that you roll and pawns that you move according to the number of numbers on the dice. And the objective of the game is to be the first player to buy at least one item from all of the 10 stores, and then you are the winner. So from past research, we can confirm that any cancer diagnosis in a child or adolescent has an extremely negative impact on several different aspects of the patient's life. These include things like psychosocial abilities, physical abilities, the ability to cope properly while enduring chemotherapies and therapies similar, a loss of control, a fear of relapse and death, body image issues, an ongoing issue for lack of self-esteem, and difficulties related to transitioning back into society once the hospitalization period is completed. Since a cancer diagnosis in a pediatric patient drastically changes the lives of both the patient and their family members, there's a strong need for useful tools in therapeutic recreation interventions to help patients regulate their emotions, concerns, and to help them understand their story and understand what they are going through. Past research confirms that play therapy and games are very effective therapeutic treatments in reducing negative emotions associated with their diagnoses. When we talk about board games specifically, there is research that has confirmed that board games give players the shared responsibility to respect rules, turns, and positions, which gives children and adolescents participating a sense of security and responsibility. This in turn increases the event of participants expressing difficult emotions that they may not normally express when they're just in a normal type of therapy. So them being surrounded by other people in their same situation, or specifically these questions that are more so related to difficulties they would be going with, makes them relate more and makes them more susceptible to opening up and to being able to share these experiences with us, where maybe in another setting they might not just be as open to it. Okay, so now we are going to move into two different videos. The first video has to do with just regular youth and how games can impact their quality of life in positive ways. The second video is going to have more to do with specific pediatrics that are diagnosed with cancer and the therapies that they go through that improve their qualities of life.
Hi viewers, Grace here. In this episode of The Genius of Play, my dad, Dr. E, and I are going to show you how play can help develop your kids' cognitive skills.
The development of cognitive skills is important to your child, and play is a great way to help boost their brain power. Play and games can help teach problem-solving skills, reasoning, judgment, and the ability to find solutions.
Play to win. They play to win. Say I'm responsible. I win or lose based on the decisions that I make.
What are you hoping to teach kids through playing chess, and how do you think it helped you the most?
I think it helps you delay gratification and don't just do the first thing that pops in your head. Kind of take time to think things through and try to find your best move. Good move. 1-2 turn. 1-2 turn.
I can't tell you how many times I've seen parents seeing games as being unimportant to their kids' needs. It's often not until they see me on the floor playing with their own kids, whether it's chess or checkers or any number of skill games, that they start to see a whole new world within their child. For me, it's not just teaching kids cognitive skills, but it's watching how they approach the game. Because often in how they approach the game, we see the world in that side of their head and then can help coach them in how to see the world differently. So as we select a game and we focus on the activity, we see it through the end. Finishing a game is important because you're teaching them cognitive control, playing skills, and honing their attention span. I'll also give them pointers why we're playing the game, and I'll give them my best game because I know that when they beat me, then they know they played a great game. I didn't do them any favors, and we all win that way because it helps teach them confidence.
Left foot green.
You gotta be kidding me! Checkmate! Have you played with your kids today?
Bye! See you next time!
Bye!
There's no way to go through cancer treatment or even a chronic illness, I speak globally, without thinking about the entire child. The psychosocial services for hematology, oncology, and bone marrow transplant include comprehensive services, so social workers, psychologists, child life specialists, art therapists, music therapists, our therapeutic recreation specialists, massage therapy, and then our school programming, which includes school liaison services as well as an actual school teacher for our unit.
We work on individual goals, which can be decreasing pain, increasing coping with being in the hospital, decreasing anxiety, and also positive interaction with family members, socialization with peers in the hospital setting.
They will bring in their guitar, they'll bring in an iPad that has GarageBand on it, they'll bring in maracas.
I see them increasing their confidence. It opens up a world for them where they can communicate, they can be who they are. Sometimes words don't do it, and music does do it.
So we have an art therapist for our unit, so she sees patients on the inpatient side as well as into our day hospital area.
I provide them with a variety of art supplies, and they kind of guide where the session's going to go, and I'm there to support them through that journey. I mean, the chemo and radiation treat the physical aspect of a child's illness, but there's also a huge emotional piece to it as well. Art is so powerful because it allows them to communicate things that they can't always talk about through words.
Which sometimes gives them insight into their own, like, wow, I am still okay, I am still strong. They're kids first. The diagnosis came, but they're kids first, so we want to put that forward first. So how do we make sure that they stay a kid?
Okay, so to confirm the benefits that the game Shop Talk can have for pediatric patients, I am going to use the study by Bettini et al. 2019 to clarify this. So the purpose of this study was to measure the acceptability, feasibility, and emotional impact on 30 different Italian pediatric patients after translating the Shop Talk game from English and Spanish to Italian. They used questionnaires to collect data from the participants to get their results of the study. The participants in this study ranged from 7 to 18 years of age, where they had to meet specific requirements to be part of the study. The criteria to be part of the study was that you had to be of the ages of 7 to 18 years of old. You had to be Italian speaking. You had to be in current treatment for oncological disease. You had to be aware that you have a tumor, and the patient has no other developmental or cognitive impairments and no other medical conditions that would make them unable to play in the game setting. So there are 3 different game settings that would be chosen for the participants in the study. First was an individual setting with just the psychologist and the participant. The second was a caregiver setting where the participant would be playing with one of their close family members and the psychologist would be engaging as a facilitator. And the third game setting was with multiple, and it would be probably all of the pediatric patients playing together, and this would allow for up to 6 players. Previous research has suggested that Shop Talk helps children and adolescents with cancer by motivating them to talk about their circumstances in a more positive and welcoming way. And the study results found that the Italian converted version of Shop Talk had an overall high evaluation seen from participants and was proven to be adequate in terms of acceptability and feasibility, to be comprehensive in relation to rules and understanding, to help participants engage, and that the topics of the questions were appreciated by the participants. Okay, so to wrap up my presentation here, I just wanted to go over a few things. So this overall research confirms that play therapy and that games are effective therapeutic treatments to reduce negative emotions that are associated with cancer diagnosis in children and adolescents. The study by Bettini et al. 2019 accurately validates the usefulness of the game Shop Talk in their study results by sharing that the game received an overall high evaluation from participants, was adequate in terms of acceptability and feasibility, was comprehensive in relation to rules and understanding, aided in helping the participants to engage, and that the topics of the questions were appreciated by the participants. So for future considerations here, I just wanted to add that Shop Talk could be a useful intervention for more than just those of children and adolescent cancer patients. I'm sure this game could help a lot more client groups, even those with chronic pain, those suffering from dementia, and things like that. Especially for dementia, it would bring back probably a lot of reminiscing and areas in that aspect. This research also confirms that there's a need for more research in TR for youth with cancer in geographic areas that we might not normally think of. So obviously we see a lot of research that comes out of the United States and Canada and Europe and places associated with our westernized ideology, but places like Italy and other places in deep Europe and Greece and Turkey and Germany, places like that where we're not accustomed to their religions. Those are areas of interest where we might think that this research could benefit us more if we knew about those places. Thank you, and that is the end of my presentation. Let me know if you have any questions or concerns. You can reach me at CaitlinCooper12345@gmail.com.